So the second part of the syllabus review is related to clinical. There are different ways that we can complete clinical during this time of pandemic. If you are working in a nursing home, assisted living, or something similar to that, hospital, neurorestorative, something along that line, contact your clinical class instructor, and they will give you the paperwork and explain the process. You have to complete a certain number of hours on the job, a packet of clinical scenarios, and then you have to come in and show skill competency with your clinical instructor to be able to pass the clinical portion. This is not a pass-fail clinical this time around. If you've taken this class before during the pandemic, if you showed up, basically you got 100. It's not that way. This semester, you actually have to earn your points. So that is 1/3 of your grade also. The clinical is 1/3 of your grade. Remember, if you are attending clinical with us in person, no call, no show is an automatic failure of the program, of the clinical and the program. So make sure that you are doing what you're supposed to be doing. Clinical dress code, it's seal blue scrubs, scrub tops, scrub bottoms, white athletic shoes, white socks. All of that's important. Hair has to be natural occurring color, no nail polish, no artificial nails. Jewelry, really shouldn't have any jewelry on, but if you did, it would be 1 post earring in each earlobe, and it would be 1 banded ring on your finger, like a wedding band, no stones. Tattoos should be covered. Hygiene, you cannot have an odor to you. You can't smell a body odor. You can't have strong perfume on, no gum or mints. Think about, you're working closely in close proximity with these residents. You need to be professional. Stethoscopes are carried in the pocket, not around the neck. Any deviation from the dress code will result in a lower clinical score and can result in you being sent home. Make sure you have a gait belt, stethoscope, goggles, watch with a second hand, pen and pocket notebook each clinical day, and don't bring your cell phones into the clinical site. Have good behavior. You can actually be removed from the clinical site if you are disruptive or have any kind of threatening or unprofessional behavior. And then confidentiality is the other really big important part. And that confidentiality is, not discussing what happens in clinical outside of clinical. You shouldn't be putting things on social media about your clinical site or about the patients, even if you're not using their name. A couple other things I want to mention about clinical. Every student will have a clinical packet that will be given out on the first day of class. The clinical packet, if you're doing clinical with us, there's 20 hours worth of that packet. That packet is due on the first day of clinical. So if you don't turn that packet completed in by that first day, then you automatically are having 10 points docked off of your clinical grade, which is 1/3 of your course grade. So you need to get started on this right away. There is a lot of really great information. You don't have to be perfectly right about it. It's about learning. It's about thinking, expressing your opinion. So there's a lot of learning that happens within these clinical packets. If you are using work hours as part of your clinical, you'll have a 10-hour clinical packet. And your instructor will give you a due date for that. And you need to have that completed on time or it will be a loss of points. Not completing it is not an option because it's part of your alternative clinical hours and you have to have a minimum of 40 hours. So it has to be done. Make sure you do it on time so you get all your points. And if you have questions, certainly give us let your instructor know. These clinical packets were also on the D2L site, so you can access them there in addition.